guys, welcome to Chemo Glow, where the glow doesn't define me, I define the glow. Please make sure you check out our YouTube channel. We actually have 3 shows on there, from our Chemo Glow podcast to our live with Chemo Glow, which we're doing right now, and our glow moments. Our glow moments are the ones that I had during treatment, after treatment, years later from treatment. They're just glow moments. Check out our Twitter, our Instagram, and share and comment, guys. I would like to see more subscribers on the YouTube channel. You guys are doing great on Facebook. I really, really do appreciate it. Thank you for sharing and commenting and putting our podcast out there. But normally we are talking about like breast cancer all the time. October was Pinktober. Well, do you know what November is? It's Lung Cancer Awareness Month. And you know the color? It's white. So that's why I have it on tonight, right? My guest tonight is changing the face of lung cancer. She is a 14-year survivor and giving back in every way. In addition to being an advocate for lung cancer awareness, Toma is active in the cause of social justice. And that's why I love her. And I think it's so great that we're doing this in November because so much stuff is going on in the world. And plus, it's Lung Cancer Awareness Month. So you guys, I want you to welcome my guest, Toma Hargrave. Come on in.
Hi, everybody. Hello.
Hey, with your UNC shirt on.
Yes, I do. Oh.
We just went black right quick, but here we go. We're coming right on back.
Yes, we had a big win today. Yes.
Oh, big win. Who did you play?
Wake Forest.
Oh, really?
Yes.
Oh, wow. Okay. Too bad I'm not a UNC fan. I'm a Duke fan.
I'm so sorry. Well, you know, my son went to UNC undergrad.
Yeah.
He went to Wake Forest for med school. So.
Oh. We have a fierce rival tonight in the hall.
Yeah, and I went to University of Washington in Seattle. Nobody cheers for them around here.
I feel so sorry for you. Thank you for having, thank you for allowing me to interview you today as my guest for November Lung Cancer Awareness Month. And I believe you just celebrated this past Monday?
Yep.
14 years?
14 years survivor. That was the date I was diagnosed stage 3B.
Stage 3B. Well, tell us a little bit about that.
Well, it was a total shock. I had absolutely no clue I had lung cancer. I was probably the healthiest I'd ever been, but I did find a little nodule in my neck. And thank goodness I had a very proactive primary care doctor who had known me for years. And so he said, well, I don't think it's anything, but let's biopsy it. And then when the biopsy came back, I got a phone call and he said, well, we got the biopsy back. Do you want to come into the office? Well, you knew right then it was bad news. And I said, no, just tell me. And he said, well, he says, this can't be right. He said, but it says you have lung cancer. He said, you need to have a CT scan right away, which I did do. And it did confirm that I had a tumor in my upper right lobe and lots of lymph node involvement. And that's what I was feeling in my neck. The problem was the tumor was in my right side and it had already crossed over to the left. So that's what made me a stage 3B patient.
And people don't understand stages. They think 1 through 4, but there is A and B after each stage, which is very important. It determines your treatment. And
exactly. Yeah. And I know it's different for a lot of other cancers. A lot of them don't stage it the same way that lung cancer does. So, and I'm not sure about breast cancer and how they stage it.
It does. I was stage 2A. Yeah.
Yeah.
They do stage it, like that. And that was my biggest thing. I kept saying, what stage was I? And right 2A, 2B, I was like, well, what is that? And it determined my treatment, whether radiation, whether chemo, surgery, all the levels. There's so much to this.
Absolutely.
So when you were diagnosed, did you shop around for you?
I did. Living in Raleigh, we had all this, well, we had 2 comprehensive cancer centers within 15 minutes of each other at Duke and Carolina. At that time also, Rex has a cancer center. It was not associated with UNC. So, but I did go there, and that oncologist just kind of told me that standard of care, he wasn't very positive, and no offense to him, he didn't have the other options. My son, being he's an emergency room doctor, when we told him my diagnosis, he said, get to a teaching hospital. That's where the cutting edge treatments are. Yep. So, and then I went on to Duke. They were a little more hopeful. And then I went to UNC, and that oncologist, who's no longer there, loved him, and he's very well known in the lung cancer community, said, I think you qualify for a clinical trial. Do you want to do it? And he spelled it out for me. And by then I'd gone on the internet and I found out how bad the survival rates were for lung cancer, because at that time it was only about 15%.
Oh, wow.
And so he actually, I was so impressed because he actually sat down and wrote out the whole plan for me without me looking at all this horrendous paperwork that you see with clinical trials. And I just decided, knowing what my options were and what my odds were, that I was going to go ahead and try this. And I always remember what he said to me, because when I looked at this, and it was a very aggressive clinical trial, and I said, should I be afraid of this? And he looked at me and he said, you better be more afraid of your tumor. And so I always say, fear the tumor, not the trial. I'm a big proponent for clinical trials. So I did it. It was a 9-month long treatment, and I've had some bumps in the road, but for the most part, and the thing about, I'm going to keep talking until you tell me.
Keep talking. Keep talking.
So since that, in the 14 years, and they're doing the same thing for many cancers, they're looking for biomarkers and for mutations. They weren't doing that for lung cancer back when I was treated. So 3 years after I had successful treatment, I had gone out of remission, and I said to my oncologist, I want my tissue tested. And so they did, and we found out that I have what's called an EGFR mutation, which actually other cancers can have too. And one of the medications that I had on my clinical trial was one of the first drugs to treat EGFR mutations. So how lucky was I?
Yes, the fact that you did a clinical trial, how many people were in this clinical trial?
I don't really know. I know there were the few people that I know in North Carolina, because it was a national, he was a principal investigator. So they were doing it all over, I guess, the country. And globally, it was not a successful trial. For a lot of patients, but I know of several others here in North Carolina, and one in particular, we're still in contact and friends, and he's still here too, and he lives in Wilmington, and he's still hanging in too. He started the trial about 6 weeks before I did. So, but like I said, globally, it was not a successful trial. It was higher dose radiation, which was very hard. That was harder than the chemotherapy I had, because I got a lot of side effects from that. And then taking this targeted therapy drug, which was an oral drug. And at the time they gave you the maximum amount. So I had a fair amount of side effects from that too. I had acne that was like I was 15 years old again.
Isn't that crazy? I had acne. My skin went bonkers during that time. Y'all are trying to kill me, but make me feel like I'm 12 or 14.
I know, exactly.
It's like, I have to put all this poison in you to kill what's trying to kill you.
Well, the funny thing was, when I asked to have my tissue tested those 3 years later, he said, well, you don't have this one, you don't have that one, you don't have this one, but you have EGFR. But he said, we knew that. And I said, well, how did you know that? He said, because you had all the heavy duty side effects, which means it was working.
Oh, wow.
I know. I thought, wow. Well, heck. But he never told me that until all the treatment was over. So, and now there's so many different biomarkers and mutations for lung cancer. We didn't know. I mean, they've made a lot of progress with that. And what I'm learning now is so many people with cancer can have the same biomarkers, but it's a different kind of cancer.
Yes. And targeted treatment is the way to go these days.
Exactly. Yeah.
And because you were in a clinical trial, and you first, let me back up. How did we meet? We met because of cancer, right? But
exactly. Yeah.
You had lung cancer. How did we? How do you recall us meeting?
Well, I remember they were starting this program at UNC, and by then I had successful treatment, and I think I had retired by then. Mm-hmm. But they were starting the Patient Lay Navigator program at UNC. I think you were already involved with the Patient Family Resource Council. I'm not sure I was yet, but that good old Loretta, she sucked me right into that. And the gal who was running the program at that time wanted us to meet, and we actually met at a coffee house somewhere, I think, in between Chapel Hill and Raleigh.
Yeah.
And had coffee, and she wanted us to work together on this program. And so and that's how I got involved. You've been a busy girl because you decided to have those twins.
And as soon as I had them,
how dare you?
How dare I go and have these beautiful twins? You want them? Can I get some time with you, with the girls? You could have them.
Yeah.
But that program, you're still a part of.
Yes, it's morphed a little bit, and the leadership that we did have changed. And so it was a little iffy for a while. But now we have some really good leadership, and of course we can't go into the hospitals right now. I can explain a little bit what I'm doing as a patient volunteer navigator. Is that I work in the actual thoracic oncology clinic with lung cancer and head and neck patients, and I actually work with my current oncologist also, who he is brilliant. He's so smart. But he said he doesn't do much for me now because I'm doing so well. But he and my nurse navigator. And so when a patient comes in, they're newly diagnosed, I go in with the nurse navigator and sometimes the doctor and meet with the patients. And I'm not medical support, I'm emotional support for those patients. And we make sure that we try to say it's not about us.
Yes.
But my nurse navigator always tells new lung cancer patients that I'm a lung cancer survivor, because I know these people have already gone on the internet and seen the poor survival rate.
And that's so important.
It is. And so when they see me, and she'll say, who else in this room has lung cancer? And they look at me, I look quite healthy. And she'll say, this one does. And they're like, their eyes get big. It gives them hope. And that's why I'm doing this, is because I truly believe that I'm still a survivor, because I'm a survivor and I'm supposed to do something with that. And I think I told you my hairdresser, because I have this survivor guilt because we have so many patients we lose. And I keep saying, I don't know why I survived. Why did I survive this? And she said, honey, it just wasn't your time. How simple was that? And I told her that the other day, and she said, oh, you gave me goosebumps when I told her that. But I said, that's the only explanation I can have right now. And so I really miss being in the hospital now, because I'm not seeing those patients, face to face. We're doing phone calls right now. We will get back there someday.
Yeah, soon, hopefully.
But, since I retired, I was a speech pathologist in public education for 42 years, and I retired. And this just gives me a purpose. It means I'm supposed to be doing this. And I don't know if I help everyone, but
you do. You even help me. She was volunteering, like, guys, she was volunteering, and it was so crazy. I was in the hospital. Hospital for one of those bumps on the road, and they thought that my heart was failing. I was having a heart attack, so I was in cardiac ICU, and you're volunteering on a Tuesday, and you came up and you were able to spend some time with me and my husband.
Right.
You
Yeah.
were really helpful to us even at that time because we needed a break from all the stuff that was going on. And
Right.
do you get tied to your patients? Like when you are um, doing your rounds, going in the rooms, do you get tied to some of your patients, like
I
emotionally?
I do. There have been, the thing is, if you only go in once a week, sometimes you only meet that patient one time, and then they may get assigned to a different doctor. And, they have lung cancer patients coming in every day of the week. I have had a few, and, would go up when I knew they were there. I'd go up and see them when they were getting infusion. And I got really close to quite a few of them.
Yeah.
And it I lost both of them. And but it's interesting because I'm still in touch with one of the wives. Just she, and we actually, there was a story that was done on one of the news stations about
Mhm.
the lung cancer, or about the patient navigator program, volunteer program, and that patient was in that video. And
Uh-huh.
he wanted to do that, and we thought he was really recovering quite well.
Yeah.
And but his wife cherishes having that video that we did together, and having him talk about, the hope. And he always made me feel so good. He always made me feel that I was doing something good for him. So and like I said, it wasn't about me, but you want to go, because cancer sucks.
It sucks. And you know what's great? And if you guys haven't listened to podcast 11, Beating the Odds with Toma, please listen to it. But one of the things at the very end that we talked about was giving people hope, and the fact that folks call us. Even if we don't know, we can point them in the right direction.
Hmm.
That does something for me when I get a phone call from a friend, a family member, and say, "Hey, what about this?" And I don't know everything about breast cancer. However, I can point you in the right direction.
Hmm.
So
Hmm.
I know you get quite a few of those phone calls.
I do, and it's really funny now. People, I mean, a lot of my former coworkers and all that will say, "Gosh, if I get cancer, I'm calling you," and it may be something totally different. But
Mm-hmm.
I, if nothing else, what the resources are in the
Yeah.
area. And like I said, how blessed we are to have two fabulous comprehensive cancer centers right here in the Raleigh Durham area. And then Wake Forest has a great program. Levine is a
Mm-hmm.
great program in Charlotte. I mean, North Carolina is really a wealth of really good cancer resources, and also the research. The research is fabulous here. So I didn't
It,
feel, but
so much.
my son was doing his residency up in Boston, which is, the Mecca, one of the Meccas for cancer or for medical. And he said, you can come up here, but I didn't feel the need. And the one thing that I like, that I feel the doctors, one of the things that I thought was really good about the
Mhm.
cancer moonshot was that it was making doctors work with each other and share their information. And I hope that's going to continue, because I always felt my oncologist would look anywhere for the best treatment for me. And it might not be here, but
And that's a great thing. My first experience when I said I was moving to the Durham Raleigh area and I was diagnosed in Charlotte, like they shut me down. There was no reason for them to talk to me, nothing. And I thought that was crazy. I come here, I've been seen and treated at UNC, but I went to Duke for a second opinion on something different that had to do with deal with cancer. And they were like, "You're getting the best care at UNC. If you're
mhm,
here, there's not going to be anything different." But I advocate for you to shop around for your care, right?
exactly. Yeah.
You need to know what's out there. And I just so happen to have the best doctor around at UNC. And I know you
Yeah.
feel the same
I
about
know. I
doctor.
know. Well, and when that doctor at UNC gave me that clinical trial and he wrote it out, I actually took it back to the doctor at Duke because it was a woman. And she was very involved with lung cancer in women, which is very important because more women are getting lung cancer now than ever before. And I took it to her and she looked at it and she said, this will bring you to your knees. It's very aggressive. But she said, I would never tell you not to do it, because they couldn't offer that to me. And I thought, she cares about me as a lung cancer patient and not her lung cancer patient.
And
And
collaborate.
I'm still friends with her through the lung cancer advocacy group that I'm involved with. And I so appreciated that. I want my doctors to advocate for me and find the best thing for me. And everyone should do that. Absolutely.
It's so important. And Erica says up here that collaboration is essential. She works in the healthcare field. She is a nurse. She was on one of our podcasts earlier, and she talked about you have to collaborate. That's how best care. So it is definitely essential. Now, tell me a little bit about some of the organizations that you volunteer for, that you represent. You've been to DC. You guys don't know this, but you are very active in social change.
Well, okay. Well, the one other thing that I did after I retired is I became a guardian ad litem. And if you don't know what that is, I am a spokesperson for a foster child in court. So when that child goes into foster care, I work with that attorney, the child's attorney, and then the parents have attorneys, and then the county, in this particular Wake County. And so I was blessed to have two adorable little girls. One is now back with her biological father and doing great, and the other one is about to be adopted. So that's kept me in touch with kids. It's a very I guess I was lucky that we had such wonderful foster parents to deal with. So I'm involved with that. I'm involved with, of course, that's all gotten crazy too because of COVID. So I can't actually visit with them. And then I have been involved for a very long time. It started out as the Lung Cancer Partnership, and now it's the Lung Cancer Initiative of North Carolina. And I was on the board of directors for a while. And it's a fundraising advocacy group, educational group that's based in Raleigh. And the fundraising that we do, that money stays in North Carolina. And I felt that was important because we have such good research going on right here. So I'm involved with that. And then, of course, got in the Patient Family Resource Council at UNC. And, and Loretta then nominated me for this group called Scoreboard, which is, I had to laugh because it's for advocating researchers to include geriatric patients in clinical trials. And I said, well, at the time I was diagnosed, I wasn't considered geriatric. I am now, 14 years later. So I'm involved with that. I have gone to DC twice to advocate for funding. First time it was specifically for lung cancer research. The second time it was for just cancer research. And, you know, the sad part about that is that you never actually get talk to your legislators. You talk to their staff, except David Price. He was the only one that actually came out and talked to all of us, and I was really impressed with that. I've spoken to the it was the American Centers for Cancer Research. I spoke with them, and I just found out I got nominated to speak with ASCO, and I'm like, how did they get my name?
Congratulations on that. That's big.
So you know, all these things are being done virtually now. So it's, I said, I retired and I feel like I'm busier than when I was working. But you know, here's what I have so loved about getting involved with the UNC group is I have met people like you and so many other very cool people who care so much about cancer. And And the people who are doing the patient navigator, like, I wish we could get more people to do it, because it is such a wonderful program. It really is.
Tell us about that program, because I started in that program, and I actually followed you around and watched what you were doing. And it is not just about like us just going in there and we're handing out pamphlets.
Mm.
It's good that they can see our faces. They see people who have gone through some stuff, and it is not about us. But I find the doctors, they call us in for a reason.
Yeah, yeah.
So,
Well, I think it's morphed into a thing where it began probably like that. But, when I go in, and the one thing I have just determined through all of this, when a person is initially diagnosed and they're getting information from
mhm,
everywhere, and then I walk in, it's like uh, they can't absorb anything else. So a lot of times I will see them on their second visit when they get their plan,
yes,
of their treatment. And so I'll sit down and I give them, in UNC, they have a book that explains all the basic things about the cancer center and all of that. And, it's amazing because the doctors and even the nurse navigators, they don't tell them about the patient family resource center. They're too busy giving them that information about what's going to happen to them in treatment. And
mhm,
so our role is kind of say, hey, there's this place down here, downstairs next to the pharmacy. Go in there and find out, things like housing and things like that, that they have no clue that's offered by the cancer center. And so you do things like that. I sit, and a lot of times I'll just sit and talk with them, and they'll have really basic questions, and they'll want to know
mhm.
what my treatment was like. And I always say, the treatment nowadays is nothing like I had. And I said, immunotherapy and all of that,
Mhm.
oh my gosh, that wasn't even around 14 years ago. And what they're doing now with that, so a lot of people are not having chemo
Yeah,
generally, or radiation. I mean, I had it all. So,
yeah. And your side effects from that, like you said at the very beginning of this, is really tough.
oh,
It,
it was the radiation gave me esophagitis. So, but I had about 3 weeks where I couldn't eat, and so I subsisted really on mashed potatoes and scrambled eggs. And
mhm,
it took me maybe an hour and a half to eat it, but I was determined they weren't going to give me a tube feeding, and I did not
mhm,
want that. And then they put me on a fentanyl patch, which is morphine.
yeah.
And so I was kind of staring at the walls for about 3 weeks, and I told my son, you don't ever have to worry about me being a drug addict, because I felt so out of control with that. But
Yeah.
it didn't really make me feel a whole lot better, but it was something I had to go through. I, you know, um, I have compromised lungs now because
Yeah.
of it. So I have to be careful. I get pneumonia very easily. But
Mhm.
I now know, as soon as I get the symptoms, I call my primary care doctor and say, oh, I've got this. And he immediately gives me usually a Z pack or something very basic. And it keeps me from getting worse because I've had episodes. I did have a brain met 3 years after I had my initial treatment. So I had cyberknife treatment, and I ended up then having a craniotomy and it turned out to be scar tissue from the
Mhm.
treatment. Um, so, yeah, I have 2 holes in my head from that.
The side effects that you have from treatment to get better, sometimes it's like, oh my goodness,
I
like my
know.
compromise. I have to pay attention to my heart. Um, I have issues with that. It's just to live, which is wonderful. It's a blessing to be here, but there are some side effects that goes along with the treatment. Now, who was your support system during this time?
Oh,
Point
well,
your
absolutely.
son.
My husband was fabulous.
Mm-hmm.
Santa Bob Hargraves. He's now retired. He's not Santa anymore. But initially, as we went through the diagnosis process, and the one doctor, didn't give us much hope, and so I was sitting there listening to this, and my husband was standing in the back, and he was crying. And I finally turned around and said, okay, I said, I need all the strength I can use to get through this. I cannot take care of you. He learned through the process. He was one. My son was fabulous support, even though he wasn't here.
Yeah.
Um, he gave me a lot of medical advice and encouragement that way. I have wonderful friends. I had all my staff. I worked through most of my treatment.
Mhm.
And when I was going through radiation, several of the therapists would drive me over to get my radiation. And so the deal was we'd go over and I'd get my radiation, then we'd go have lunch afterwards, and then I'd go home and take a nap. So um, the one thing that I did learn about that is ask for help. Ask for people to help you, because people want to and they don't know what to do.
They don't know what to do. And when you say cancer, and if you say lung cancer, they don't know what to do. And one of the people that are on, Erica Lee Mack, she just asked a question for you. She said, did you have the emotional and spiritual support during treatment? And were you able to accept all of it? Accept it.
Well, the night that I got the results, and we told all the family, and I hate to admit I did this, but we did call our pastors. We do have spiritual support, and
Uh-huh.
the pastor talked to me, but then I told him, I said, you need to talk to my husband. He
Yeah.
needs that support. So he did that. I went and got my nails done.
I got my hair done.
No, my nails. Got my nail. Well,
Yeah.
you did. I got my
Yeah.
nails done, and then my very closest friend, she came over there, and it was also the beauty salon and the salon. My stylist who told me it wasn't my time, and my friend brought a bottle of wine.
Mm-hmm.
So we sat there and we talked and cried, and she got her hair done. I got my nails done, and it took the edge off. She went
Yeah.
with me. She also went with me on several of my visits. But then I had my best friend from college. She flew out from Montana and spent some time with me. My sister came out. Um, neighbors were really supportive and good. And uh, I felt very surrounded by a lot of support. And I remember the night before I was having my craniotomy, and we had a very young pastor who I loved. I felt like he was my second child son.
Uh-huh.
And he came and prayed with us, and he said, what's your biggest worry? And I said that um, I won't survive to see my son married and have children. Well, he's married and has 3 now.
Oh, wow. And
So
now you're a caregiver yourself.
yes, my husband was diagnosed with Parkinson's disease. He was exposed to Agent Orange in Vietnam. And
Mm.
so we've been going on with that for about 6 years now. And it wasn't too bad for a while. It's kind of, it's a progressive disease. And so
Yeah.
he had the deep brain stimulation surgery, and that kind of took care of tremors, but it didn't take away the Parkinson's.
Yeah.
So yeah, it's part of our journey. So, we're doing okay overall.
Yeah.
So I have to tell you this, he doesn't come upstairs anymore. And so we have this big TV room upstairs, and he sent me a message yesterday, and he said, I bought you a really big new TV for upstairs. Because the one up here didn't have Netflix, and I was so upset about it. So I have a new smart TV coming upstairs. And then he said, I'm going to really work on getting up on the stairs again. If that's all it takes to motivate him,
Hey,
yay.
my husband just went out and bought a new TV today, so I'll take that. He was like, I need something to look at because we've been in our new home for about 2 weeks. My little studio's coming together. Did you get your new carpet yet?
Me? Yes. It was done in 2 stages. That's all been done. The decorating is pretty much done in the family room. I have one new chair coming, and that's
Yeah.
arriving on Monday. And then I think we're going to try to devote some time to outside, because like you now, we have a ton of trees.
Yeah.
Nothing grows in the back because
All the
we love
trees.
the trees. So the grass, it's like mud back there. So I think we're going to just put pavers in and forget about trying to grow that stuff. So we've
And,
been here 24 years though. So
oh,
yeah,
wow.
yeah,
24 years.
yeah.
goodness. I'm loving where I'm at now, and now I'm so happy. You're my first live in my studio. Um, yeah,
Oh,
it's
yay.
kind of set up, but not really. But
Well, look at you got your pictures all up there, and I'm
I
so
cannot take
impressed.
credit for that because their godmother is here, and she came upstairs and it was empty, and she said no. So she went downstairs and started unpacking boxes, and we did it together. And
Oh,
she
good,
but
good.
I am so glad to have you on. One of the another thing I want to talk about before we go is we talked about lung cancer and breast cancer. We talked in the podcast just about the difference between the two and how it looks like one is more pink month. Like somebody
Mhm.
Erica, not Erica, Africa put up here, she didn't know that white stood for lung cancer because everything's pink, right?
Right,
I knew
right.
about white because my mom had lung cancer and everything's pink. So it's so important that we know what the benefits are of Lung Cancer Awareness Month, where they can go to help, where do we need the most help at for lung cancer. So let us know. What would you suggest someone who's interested in supporting the Lung Cancer Awareness Month movement through all the years? What can we do?
Well, people need to understand that lung cancer is the number one cancer killer of men and women,
Mm-hmm.
and it's the least funded.
Yes.
So, and we do not begrudge the success that breast cancer has done because they've really been able to get the funding so that they have a much higher survival rate. I learned something really interesting though this past week, um, because my best friend from college has metastatic breast cancer.
Mm-hmm.
And in talking to someone else, he told me that the funding for metastatic breast cancer isn't as good as the other,
It's not.
whatever that is, the initial part of that.
Yeah.
And I was like, oh, I did not know that, because she got a little upset with one of the things I'd put out, that more women die of lung cancer than breast cancer. And
Mm-hmm.
then when I learned this, I'm like, okay, she had a right to be upset because of
Yeah.
where she was in her journey. And so I learned something about that. I think the thing that lung cancer deals with, and it's been going on forever, is we deal with the stigma,
Yeah.
because people think that if you smoke that you get lung cancer.
Mm-hmm.
Now the reality is that only about 20% of smokers actually get lung cancer. They may get other things, they may get heart disease and stuff like that, but they can also get bladder cancer. There's other cancers that are caused by smoking. I will share with you, I was a smoker in college,
Mm-hmm.
as everybody in college was smoking back in the late 60s and 70s. And my grandfather smoked his entire life, and he died at 91 of being 91. So he didn't he didn't have lung cancer. He just died of, maybe he had heart issues, I don't know, but he was 91 years old. So I was 58 when I was diagnosed. So of course then I had this mutation that we didn't know about. I think the big thing that we feel in the lung cancer community is, number one, the first question people will say to you is, did you smoke? And it has become somewhat offensive now,
It is.
because when people say, well, I have high cholesterol, do you say, well, did you eat a lot of fatty foods? So I mean, we don't do that, we don't
Yeah.
say that to people. So I think, number one, when we do this education with people, if you have lungs, you can get lung cancer. It's as simple as that. And more young women are getting lung cancer, and they have these mutations that we didn't even know about now.
Mm-hmm.
They are surviving longer, but we would love to have the same research funding that some of the other cancers are getting. Prostate gets decent funding. Pancreatic, they're fighting the fight too. I mean,
Yeah.
that's an awful cancer too. I think getting educated about lung cancer, you have to be careful when you go on the internet. because
Yes.
sometimes it's negative. And but find some of these supportive groups. There's the Lung Cancer Initiative of North Carolina. There's Longevity, which is a national group. It's called the Go-To Foundation, which is they were two lung cancer groups that have formed. We don't have the big umbrella group like Komen was
Yeah.
right now. So but there, if you're looking for something local in this area, we do have the Lung Cancer Initiative, and if you go online, you can find it. We fundraised with, well, we this year everything was virtual, so we had
Yeah.
a virtual 5K and a 2K, and we have a gala that they actually did online this year also. But I always say to people, if I didn't have lung cancer, I wouldn't have all these new set of friends that I
I
have.
know you meet so many people. Like one of our guests up here said something about they didn't know about the different support. So Tasha Prescott was like, wait a minute. I had no idea that, didn't know about the support is different in the breast cancer world from whether, using the word thriver to survivor. That was a big thing. That
Right.
changed. Komen did a whole Thriver initiative because they're like, we're living with breast cancer. And,
Mm-hmm.
me personally, I don't use the word survivor. It's just me, you know. I don't like the color pink. It's just me.
Yeah.
But I understand the process. I understand um, the funding. I understand there's power in pink. And then
Mm-hmm.
power in white and power in teal. These are all the different colors that represent the awareness of different type of cancer. And I wish that my mother had someone like you to support her going through because we didn't know. The lung cancer
No.
person.
And I think that I do think because people, when they look online and get the statistics, they immediately lose hope.
Yeah, yeah,
And you try to get people to gear into the right area, and there's a whole lot more supportive groups that are out there now. I think the thing is, and that's what I love about the Navigator program, is there
hmm
you do have people then that can connect with you. But the
hmm
Lung Cancer Initiative here in North Carolina also has, you can go online and they will connect you with somebody else. Of course, you have this whole confidentiality thing, so you have to
yeah,
be careful with that. But yeah, we just want people to realize that there's a lot of innocent people out there who get lung cancer, and it's, we've heard the comments, well, if you were a smoker, well, you deserve what you got. Nobody deserves any
no.
cancer.
I wouldn't wish cancer on my worst enemy on a
No.
good day, all the way around day. When you hear those words that you have cancer, when you hear those words, it's so, so, so scary. And
Right.
you hear the words lung cancer, and then you're feeling great. You said you were great. You were doing what you needed to do. Oh my goodness. Is that your husband right there?
That
It
is,
is.
that was, we were on our, a couple of years ago, we had lived in Australia right after we got married. He was in the Navy, and that was on the cruise. We did a 34-day cruise around Australia.
Oh, that's
And
right.
actually, oh, there he is too. Our son actually was born in Australia. So we've talked about maybe he should go back there and live.
Second place to
We were
stay.
discussing that and I won't get into the politics, except that we said, oh my gosh, if something, doesn't go the way we hope it goes, we might all move to Australia.
Well, I'm glad it went the way that you wanted to go.
Me too. Yeah, I will say I'm involved politically, and this
Yeah.
was, for me, it was hopeful because, and I will share this personally.
Mhm.
Joe Biden knows about cancer, and
Mhm.
Joe Biden was the one in charge of the cancer moonshot. And I believe he may not provide all the answers, but I think he understands what direction we need to go for all the cancers. So I was very happy that
Yes.
he got elected. So I'm sorry if others didn't feel that way, but
No, I'm glad that you mentioned it. I had to wait to post your podcast because I was like, okay, when are they going to call the election? I got,
I
and then
know.
on the day that they actually gave their speech, and I was like, I can't hold off. I have you coming up soon. When November is a big month, but I knew if I put it out there, people would listen. And guys, you really need to make sure you pay attention and listen to our podcast. You did such a great job on that podcast, and I
Thank
listened
you.
twice today.
Oh,
I am so happy that you're giving this time to me. I want to make sure that I didn't miss any comments from anyone. A lot of people are saying they had no idea about things about cancer and they're learning a lot. And that's the reason why I'm doing Chemo Glow. Because again, what they see, the glow doesn't define me, I define the glow. How we walk this, whatever
mhm,
it is, beating the odds. And I said that because we talked about clinical trials. You talked about maybe this will help someone else.
mhm.
Even think about, oh my goodness, this I possibly might make it not make it through this, but this will give someone else something else. So clinical research is so important. It is
It's
so,
important with every cancer. I mean, of course, I feel the ownership with the lung cancer and that we certainly need more research. We are making progress. It's slow, but we are making progress. And the treatment that I probably had 14 years ago, I wouldn't be having today at
yeah,
all.
you were
So,
that.
yeah. So, yeah, it's just, and when I write all the congressmen and I say the concerns and I get these canned letters back, and it's like these people just don't get it. And it's just like with COVID,
Mm-hmm.
until you are touched personally by COVID, you're not going to get it. And
You're not gonna get it.
I went and got pizza last night and at this little place and carried it home. And there was this little pub next door. The
Mm-hmm.
place was packed with people without masks. And I'm like, and I'm sitting at home trying to be safe so I can live long. Like I said, I fought too hard to survive lung cancer for you people to ruin my life.
From COVID, my
I
brother
know.
do it. I'm not. I went out with my friend Talanya, and we were out, and I was like, yeah, nobody has on a mask. Let's just go. But I was just, until you've been touched and people are like, well, you look healthy. It doesn't, it's COVID. You were going to do a research for COVID at one time. You were going to,
I did sign up for it because Carolina was doing one of the vaccine trials,
mm-hmm.
and they did call me, but I guess I didn't qualify. I was either too old or they were concerned about my lungs or something.
Yeah.
And let's be honest, they want the clinical trials to be successful,
Yeah.
so they don't want people dying off from it. Not that I think I would, but
Mm-hmm.
like my oncologist, I said to him about doing the trial, and he said, I think you're fine on doing the trial. He said, you're at risk not because of your cancer anymore. He said, you're at risk because you're old. And
Well,
I'm
thanks
like,
for
well,
that one.
thanks. I'm, and I'm sorry, but I may be 72 years old, but in my head, I'm still 35. So,
Oh, you are, and you're doing so much for lung cancer awareness, the lay navigation program, and just all the programs that you fight for. You really do.
well,
But
just be careful when you volunteer for stuff because, they find out you like to volunteer and then they just suck the life out of you.
I don't know how I became the vice president of the PFAC. I went to the bathroom, I came back, and they was like, "You're the vice," and I'm like,
I
"Did you
had
see?"
nothing to do with that.
Yeah, right. I'm glad to be the vice president of the Patient and Family Advisory Counselor at UNC Cancer Hospital. Please come
It's
and
a it's
here.
a wonderful group. It
It
truly
is. We're
is.
doing great things. Well, Toma, is there anything else you would like to say to our audience?
I just hope, thank you all for tuning in. And
Yeah.
thank you for letting me educate you a little bit about lung cancer and knowing that, when people would when and if people say, you know, so and so, my family member or whatever has lung cancer, you know now that you can direct them to places where they can get advice and hope.
Yes.
And of course, we always love, come on out and join us on our fundraisers whenever we get back again. You know, we just finished that one, and then we had the Parkinson's one last week, so we're just shelling out money everywhere. So.
Well, I guess it's definitely saying thank you. Stay in the backstage. Don't go anywhere. I'm just going to sign off from Facebook and let everybody know. Again, the glow doesn't define me. I define the glow. Make sure you guys are tuning in. I hope you guys like what we're doing. We're going to take a break next month in December. You'll get the best of Chemo Glow on our YouTube, Facebook, Twitter, Instagram. You can catch us on all of our platforms. So make sure you guys check us out. And in January, I have my guy DJ. I haven't even asked him yet, but he's coming back. He doesn't even know it. So DJ's coming back. I have Tasha Prescott who's going to join me. We're going to talk about everything. So I appreciate you guys. Enjoy your holidays. And until next time, bye.